Are you struggling to navigate the perimenopause or curious to learn more about the menopause from some of the top experts in this space? I am so excited to tell you about an upcoming event, She Thrives, an evening in conversation with myself, Dr. Kelly Casperson, who joined me in episode 89 for a brilliant chat about sex during midlife, and Dr. Vonda Wright, who was on episode 54, who shared how to conquer midlife and beyond with strength training and nutrition. Join us on Monday the 3rd of March at Newcastle City Hall from 7 p.m. A percentage of every ticket purchased will also be donated to the Debbie Gaunt Foundation, which supports women's mental health during these transitional years. To book your spot, click the link in the show notes. I can't wait to see you there. This is one you're not going to want to miss.
Could you explain to us why we're seeing so many people with sore joints in their hands or sore feet? I keep seeing people who've got hips that are so sore that they can't lie on their side in bed, or as you talked about, these frozen shoulders. Would you be able to explain what is actually going on that we're getting all these symptoms?
Yeah, what is the science behind musculoskeletal syndrome of menopause? Absolutely, I would love to. Hopefully people know by now that estrogen receptors are ubiquitous on every tissue in the body. So for the lay people listening, it's just not like proteins circulate and then somehow work. Every cell surface or in the cytoplasm of the cell, the jelly of the cell, there's these receptors that just sit waiting to do all the things they're going to stimulate doing when something sits in the basket. So when estrogen receptors are sitting there on every tissue, estrogen sits in and it does things like helps to control bone density, helps to build muscle, helps to control inflammation. But when estrogen is absent, all those amazing downstream things that estrogen would have done are undone. For instance, let's take things one at a time. So frozen shoulder and total body pain or arthralgia. Those are secondary to inflammation. Estrogen is a huge anti-inflammatory and works directly on the immune system, coordinating a giant molecule called the inflammasome. Without estrogen, our inflammation skyrockets, which leads to a lot of different diseases, but in particular in the musculoskeletal system, inflammation of the soft tissue, such as the capsule of the shoulder, leading to frozen shoulder, or total body pain, such as arthralgia. So that's inflammation. The second musculoskeletal trick of estrogen is controlling bone density. Now, I keep on my desk this femur. This is what, when 1 in 2 women will have a fragility fracture or fracture due to bad bones. When you break your hip, usually right here in the neck, that's the back, I'll do it in the front, right here, 50% of the time you will not return to pre-fall function, and 1/3 of the time you may die from the complications of having such a devastating, life-ending injury. Well, estrogen helps control the way bone is made. There are 2 major cells and a bunch of steps that make bone. The osteoclast that breaks down bone and the osteoblast. And they work in coordination to balance bone growth. But estrogen works to dampen the effect of osteoclasts. And without estrogen, osteoclasts go along the side of your bone and we become unbalanced. And more bone is resorbed than the osteoblast can possibly build. And so you're still capable of building bone after menopause, but it's out of balance. And so that's why estrogen is so critical, is to balance bone absorption. Estrogen is critical for protecting our cartilage. That's why before 50 years old, men have more arthritis than women. After 50 years old, women have a rapidly progressing arthritis picture that can lead to devastating pain and the need for total joint. I claim adipose tissue in the musculoskeletal system, and our fat shifts from the periphery to our viscera, which is smothering our guts, if you want to say it, something like that. So those are all part of the musculoskeletal syndrome of menopause with one mechanism. Estrogen is no longer there doing all the things it once did.
And so if you had someone who came to see you who is, perimenopausal or postmenopausal and they've got their frozen shoulder, would part of your treatment be to discuss giving them estrogen replacement?
I ask each and every woman that comes to see me who is midlife if they have made their estrogen decision. Now, word's gotten out that I do this kind of care, and so people are coming from all over the place, all over the world, or they know I'm going to ask them that question, or they've already made the decision. So people are looking less deer in the headlights now than they did previously. But every woman I ask, and I phrase it like that: have you made your estrogen decision, or you need to make your estrogen decision? And the way I tell them to do that is, number one, if they need the data, they need to go read Estrogen Matters by Avram Blooming and Carol Tavris. It's the book that pivoted my whole life. And I tell them that in person, and I'm just so thankful. Read the book if you need the data. Number two, menopause.org is a great U.S. website that has a big patient library. They can read the statements on what big organizations say. And Australia has a menopause society too. And then three, there are lots of the menopause that have great books. And Grown Woman Talk by Sharon Mason, of course, Mary Claire Haver's The New Menopause. There are several others. So just pick up one of those encyclopedic books on menopause. And I said it today, so that you know what's coming. You can't avoid it. You might as well know what's coming and know what to do about it. That's how I ask women to make their menopause decision. And then there are some women whom I will prescribe for myself, but most of the time I refer them to one of the great telemedicine platforms that there are for menopausal women or midlife women, all of whom I know their CEOs, I know their doctors. So it's not just a random recommendation. It's because I actually know the founders of the company, the doctors who serve. And so I give people several recommendations for telemedicine platforms because, as you must know, it's hard to find a doctor who has either enough education through formal education or enough education through self-education, as I do, to do that properly. And so it's easier to say things like, keep your gynecologist, have them do your pap smears, but if you need menopause care and they look at you like that's not what I do, go to a platform. Instead of fighting the battle, just go to a good platform.
Yeah, absolutely. It's the same here in Australia. I've even had someone fly from Cairns, which is right at the top of Australia, all the way down to me. So, you definitely need to try and find your specialist. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.